all of a sudden there was this explosion of diseases in my patients. The CDC said that there were about 19 million new cases of sexually transmitted disease in the country, but it's all through the Bible that we are blessed by following His guidance.
There is a silent sexual health epidemic in America and the world, especially threatening to teenagers and young adults. But it is fixable. Today we're going to hear answers to what is the success sequence? How does sex relate to poverty? What is the unreported sexual health epidemic? We have answers and plans of action from founder and CEO of the 30-year Medical Institute for Sexual Health, Dr. Joe McIlhaney. Dr. McIlhaney, we're so glad you're here.
Thank you, Natalie. Thank you. I appreciate you having me.
Well,
because I like to get my message out. It's been on my heart for years, and thank you for giving me this opportunity to do that.
People think there's a problem, right?
Mm-hmm.
But I don't think we really even sort of scratch the surface of how difficult and how bad the problem is. And so I'm so glad that you're addressing it. And you were a obstetrician gynecologist.
Yeah, in Austin.
Working in practice.
Mm-hmm.
And what then made you lean to being founder and CEO of the Medical Institute for Sexual Health?
I think I saw God working in my life through this, with me not really wanting or even anticipating making a change. I was just a regular OB-GYN in Austin. Started practice there in 1968. I was doing a good job. I had patients like me, and I liked them, so I loved what I was doing. But about 1980, all of a sudden there was this explosion of diseases in my patients that was just totally startling. For example, HPV, which is a cause of genital warts. And I began seeing these with so many of my young patients because HPV is a sexually transmitted disease. And kids were picking this up because of the change in the sexual climate that began really about 1960 with birth control pills, where been from 60 to about 80, young people began having this idea that they could have, they call it free sex, but and not have any problems from it. And now I was seeing them, they've been having sex the past few years, and with pre-cancer, the cervix from HPV, genital warts, and so forth. And then it was right at 1980 when we realized about the HIV epidemic. We didn't know what it was. But it was the beginning of the HIV epidemic with no treatment. So we were beginning, and I didn't have HIV patients in my practice, but they were all around. They were dying from these diseases, starting about 1980 also. 1982, the cover story of Time magazine was the new scarlet letter herpes. All of a sudden was just exploding everywhere. So, and I was seeing this with my patients. I remember a lady that came in who had sores on her vulva, and I examined her, and she had herpes. She was about 47, 48 years old, and she started screaming. The patients out in the waiting room could hear her screaming. He said he knew he had this disease. Well, it turns out that, and when he told me, well, her husband died about a year before. This guy had been a friend of them, and he talked her into having sex, and now he'd given her herpes, and it was just driving her nuts that she had this disease. So that's just one example of what I was going to see in my practice all the time.
Also herpes, doesn't it? Is that the one that doesn't go away?
Yeah, when you get herpes, it's lifelong.
And then you have those
you have these sores that break out. And it's sort of like fever blisters of the vulva. But, and of course, if you do oral sex, you can pass the fever blister virus, which is also herpes type 2, to the vulva or penis. But yeah, once you get it, you have it the rest of your life. And of course, I'd have patients who would, matter of fact, just in the past year, there's a lady in my church who's about to get married, and she silently said, well, what if somebody you're going to marry has herpes? What do? I said, well, you go ahead and marry him. It's not going to kill you, and you know you will get it. And there are drugs and antivirals that can suppress it. So you'll be okay, but you'd rather not have it because you could give it to your child when you give birth, which I had happen with Steve and his wife. Baby almost died until they actually got it into the hospital, got treatment for it. So we're talking about these diseases that became very, very common, even as early as 1980, 1990. So my patients knew nothing about this, Natalie, and so I started doing some speaking and did some slides that showed the diseases of people's genitals, and people started asking me from all over the United States for copies of my slides, and I was on Dr. Dobson's program, Focus on the Family, a lot, and we talk about it there, and these people would start calling me. So I had a very busy practice. I'd help start the in vitro, well, I'd start all the fertility stuff in Austin, laparoscopy, microsurgery, laparoscopic laser surgery, then IVF. And I was busy. And then I was getting calls from all over the country because it sounded like I was an expert on sexually transmitted disease. And so we started the Medical Institute for Sexual Health in 1992. And then by 1995, it was getting so busy, so many requests for our materials and our information that my wife and I prayed a lot. And so we just walked away from my medical practice. Yeah. But also we've been able to spread a lot of information, Natalie, but still people just don't know. About 4 years ago, we were saying from the CDC, the CDC is the nation's health clinic, if you will. It's the group in the country that does the research that everybody relies on. CDC said that there were about 19 million new cases of sexually transmitted disease in the country. Just a couple of years ago, the CDC started saying there are 26 million new cases of STD in the country. Last year, 26 million.
Last year, in the United States alone,
yep,
there were new infections. That's not people that have already had it.
That's not the people that have herpes that'll have it for the rest of their lives. But this is new infections with people that haven't had herpes or haven't had HPV. One of the problems is a lot of your audience, a lot of people listen to us, are good parents and they're raising their kids well and they're guiding them about what is God's plan for sexuality and for marriage. And so a lot of them don't get this, but a lot of people that don't have parents that are Christians or parents that are giving them good guidance about their sexual involvement, they're getting this stuff, a lot of them, around our good kids, if you want to say that. And of course, some of the kids that seem like they're doing well are getting involved in stuff that parents don't know sometimes. It's just everywhere, it really is. They're really suffering from this a lot. And the middle income population that's not Christians and not guided by what Scripture says are suffering a lot from this too. My work was in fertility care. And when back then there weren't reproductive endocrinologists, I was sort of that guy in Austin that was doing the reproductive medicine. It's heartbreaking for people that want to have a child and can't get pregnant on their own. A lot of them will adopt, but still it's really a heartbreaking thing for this woman I'm thinking about. My point is that people will just do almost anything to try to get pregnant. Back in the days that I'm talking about with the start of that IVF program about 1985, along in there, the most common reason for infertility, if the woman was the infertile part of the couple, the most common reason to be infertile was because of sexually transmitted disease. Chlamydia she'd picked up back in high school or college and now couldn't get pregnant as a married woman who's been trying 3 or 4 years and still can't get pregnant. Today it's the second most common reason for infertility.
Wow.
Is chlamydia.
And that is something you don't even know you have it. So In other words, people
That's
think,
right.
you know, it's perfectly fine and perfectly normal to have sex with all kinds of different people before you get married, or at least some people do. And what you're saying is you get sexually transmitted diseases that people don't even talk about. Is that the unreported sexual health epidemic today?
Our organization, our work, my personal angst or pain for my patients started with sexually transmitted disease. But the real epidemic is kids who have chosen to cohabit instead of get married. And there are more kids cohabiting with their first living experience than there are getting married. That's the real epidemic, because then that is what results in so many problems, both for people individually and for society in general. But it's that pattern that young people get into. Let's just have sex, and then, well, let's just live together, and then that results in a lot of things we can talk about. So that's where we've come with our work, is say, yeah, sexually transmitted disease gets people's attention. It should, because it's horrible what's happening to people. The basic problem is this attitude about sexuality. And what's happened is people doing what they think is right in their own eyes, and that is just go to bed with whenever they feel like they love someone or just want to.
Compare sort of the world's value to God's plan.
Well, that's wonderful. I'm glad you asked that, because may I be personal about this?
Sure.
Okay. Well, my wife died of Alzheimer's 6 years ago. My first wife, I'm going to put it that way. A lady moved into this retirement home where I had my wife with her husband with Alzheimer's about 4 years after we had moved in there. My wife died 6 years ago of Alzheimer's. Then her husband died about 2 years ago of Alzheimer's. So we fell in love. And I'm 89, she's 88. And so we dealt with this sexual thing for us as single people. Then we got married, actually. Everyone told us we should go ahead and sleep together. And why not? Because you can't get pregnant, and who cares about people your age? We studied the scriptures about marriage. And it's not that, I'll just give you a summary, Natalie. It's not that God is trying to restrict our fun in what he says about marriage and about sex, but it's all through the Bible that we are blessed by following his guidance. And what he says about sex is for marriage, period, and don't do it unless you're married. Here's the problem for kids today. And that is that, and this is from research done by Mark Regnerus, a researcher at the University of Texas, a tenured professor there, who has shown that today the majority of young people, girls and boys both, feel like they have to have sex by the time they finish high school, or certainly by the time they finish college, to be normal. That if they don't do that, they are not normal. He calls it their script. The script they have in their brain is, I've got to have sex with this person if he wants to have sex, because otherwise I'm just not a normal person. And the worst thing in the world for a young person in the ages of high school or college is for people to think they're not normal. And there's incredible pressure. We have a black friend who has told us that in her high school, she was still a virgin. Her friends would gather around her and just berate her and kid her and make fun of her because she hadn't had sex until she finally did. So that's the world our kids are living in, and we don't know that's what it's like for them. Our goal in our work at the Medical Institute has become a project to change the American culture for kids, so that in 10 years, and we have a 10-year program we were working on, in 10 years the kids will say, I'm not going to have sex unless I'm married, period, and be supported by that by society around them.
Could you frame those problems in society today from sexual health? Because we're talking about them, but I don't think people understand this long list of other things that comes with it. And do we need to start first with what is the success sequence?
Oh, sure. I think that's a good place to start, Natalie.
Yes, I think so too.
Thanks for bringing that up.
And it's the positive angle.
There's a couple of researchers at Brookings Institute in D.C., and Ron Haskins and Isabel Sawhill.
And they're secular, right? They're not, it's not
Brookins
faith-based.
is secular, and
It's
they're
not
really sort
faith-based,
of
yeah.
liberal. They came up with the success sequence from their research. And it's really solid research. It's proven by many other studies now that if a kid will finish high school, get his degree from high school, get a full-time job, then get married, and then have his children in that order, in that sequence, only about 3 or 4% of them will end up in poverty. It's just dramatic, because if we look at our low-income parts of Dallas, for example, or Austin, or anywhere else, the poverty is rampant there. If those people had followed that success sequence, had finished high school, gotten a full-time job, gotten married, then have their kids, we would not have that poverty problem that we have in these big cities, period. It'd be taken care of. But it's a whole lot worse than that for the people that don't do that, Natalie. Because, for example, when kids have sex before they get married, and then they get married, they're more likely to divorce. So the idea of kicking the tires before you marry this guy, scientifically proven to be dangerous. Because when they do get married to that guy or somebody else, they're more likely to divorce. By that time, they often will have kids. So the ones that get married have kids, then the moms, it's almost always a mom left with a baby, or the ones that are cohabiting are more fragile. They're more likely to fall apart and have a child that's left with the mom. The problem is that the kids, first those families of single moms are more likely to be in poverty. The kids of those single moms are less likely to do well in school. They're more likely to have emotional problems, behavioral problems, and that just produces rampant problems. So we already talked about poverty that results from it, from this lack of marriage culture we're living in. We have educational problems with kids that are not doing well in school. We have behavior problems. And so, for example, as far as guys doing poorly, if you look at prison populations among the men, most of them don't have a father do not have a father in their home. I see these riots going on, and I see all these guys running around breaking through windows. I'm saying they didn't have dads. They needed dads. So I think if we could return to a real focus on the marriage culture, that a lot of these social problems we think are just intractable can be solved, including battered women. They're more likely, a woman's more likely to be battered in a cohabiting relationship than in a marriage.
That's what I've heard as well, but I feel like most people don't know, is there is a correlation with sex before marriage and fatherlessness. You know, you have the babies early and all that, with even, you were saying poverty, et cetera, but also I've heard it correlates with drug abuse, alcohol abuse, physical abuse, verbal abuse. I mean, just you go down the list, illiteracy, like you say,
That's
imprisonment. All these things are, are part of, and tragic. You know, when you think about battered women and child abuse and those kind of things. But there's a success sequence, and wouldn't you know, it matches the Bible.
It absolutely does.
Wouldn't it? Shock of all shocks.
Research, it's really common sense too, and it's also not. See, the Medical Institute from the start has been a scientific organization. We've never been a Christian or religious organization. We have been focused totally on reliable science all these years. But because we have pushed on the idea of marriage and pushed on the idea of not being involved sexually unless you're married, we're being accused of a religious organization. Well, we're not. We're just talking about what the research shows. And research actually does show that the scriptures are right.
That's right. Well, and I know we're going to get into this, but and let's do it. So we've talked about those things. We can step into what the also unreported skyrocketing kind of highlight of the sexual health epidemic today, meaning the sexually transmitted diseases.
STDs, yeah.
People watch media, everything is telling you all these wonderful good things. You get the picture opposite of what's the reality.
Yeah, you're exactly right.
And so
I'll tell you what,
nobody tells you about these diseases that you're going to get and have for the rest of your life, and
that's right,
keep you from being able to have children and all these other kinds of problems.
Yeah, it's really an environment, a world that's unfair to particularly our girls. I wrote a book called Girls Uncovered. I wanted to call it Naked Girls because we've left them naked to basically what guys want to do with them. It is a problem for guys. Guys are more likely to be depressed if they've been involved sexually than if they haven't. But the people that really suffering are the girls. And we have left them unguided, unguarded in today's world. It's just, and it's not a fair environment for them because, like you say, everywhere in the media, everywhere on movies, everywhere in books, they're encouraged to believe that they can get involved sexually, that that's a normal thing and they can't get hurt.
And that's glamorized. So, glamorized is the good, fun, and the guy's not going to like me.
Yeah, that's right.
Unless
And sometimes they do. A guy will leave a girl because she won't have sex with him.
And that's a
good riddance.
Exactly. We want to empower you girls out there. I know I was just talking with a lady who she tells her daughters that you do not want to, throw your pearls to swine, which is a verse, but you are, made in the image of God.
That's
you
right.
have dignity. You have worth.
Yeah.
You have value. And the guy is going to, want to physically do this. Don't throw yourself away.
Yeah.
In a sense.
That's right.
And you don't need to. You can wait for the person who really cares for you.
So important. We are made in the image of God. Girl, you're made in the image of God. You're valuable. You do not want to give yourself away cheaply like that. Matter of fact, you don't want to do that unless you're married. As far as STD, that's horrible. But it's almost, to me now, with the depression and suicide ideation that our kids are going through, that's almost, to me, worse. Over 50% of girls that are high school age, I'm thinking about that research report on them, over 50% of them are depressed to the point that for 2 weeks of the last year, it interfered with their behavior, with their activities, and what they wanted to do. I mean, we're talking real depression.
50%?
But we just, over half of them are. A third of them have thought about suicide, and about 10% have tried. Well, we just a month ago, were able to dig into the CDC research. It's called the Youth Risk Behavior Survey, that showed this much depression. Matter of fact, they just came out with the newest version. The numbers are almost exactly the same. But what we began wanting to know is, well, what would it say about sexual behavior? And so they actually had the data in there for us to dig out. Nobody's reported on this, nobody.
Really?
And so what we found was that the girls that had had sexual involvement were like 70% likely to be depressed. The ones that hadn't, only about 30% were depressed. But as far as suicide, the ones that had actually tried suicide, ending up in a doctor's office or an emergency room, the ones that had sex were 5 times more likely to have done that than the ones that hadn't had sex. So it's not the only reason kids are depressed, but it certainly seems to be one major reason we're seeing depression among our young people today, is this whole sexual thing. Related to this, and we don't really have good data about this yet, is kids that have questions about their gender. So we have kids that they get involved in sex, they're depressed in part because of that. We know that now. Kids are questioning whether they're a girl or a boy, and they're depressed because of that. these people think I'm a tomboy, so I must be a boy. Well, that's depressing not to even know if you're a girl or a boy. So this whole world kids are living in is a depressing world. It's really, I said earlier, it's unfair to them to lay this world out for them like that. So that's the work I'm totally committed to. I think it's horrible the way this is happening with our kids, and we want to do something about it. That's what my whole commitment to this is. 89 years old, and God won't let go of me. But until He releases me, I'm going to be available to try to do something creative to try to change this for kids.
I believe there's a whole lot of lies when you wrap around that depression and the sexual, the suicide attempts of of people that are having sex before they're married. I believe there's a huge lie out there.
I agree.
That this is going to make you happier. This is going to make, and instead it's actually the opposite because, well, being a Christian organization, being a Christian, it's just not in alignment with what. No. With what God wanted for you. He wants the best for you. His rules are not like something He wants to bully you into.
No, or take away our fun.
No, it says 8 times in the Bible at least, I give you these commands so that may go well with you,
right.
so that you may have joy. And Jesus said, I give you these commands so you may have joy and that your joy may be complete or full. I mean,
that's exactly right. And
really,
that's what you and I want for our kids. And that's what our Christian parents want for our kids. The parents that aren't Christian, I think, and even Christian parents, I think, are really questioning their teaching kids just what you said, that sex is really for marriage. Because I think they're, especially ones that aren't Christian, but the ones that are Christian, I think still are saying, well, is this too restrictive? Is it really too legalistic?
Because the culture is so much pressure and teaching so differently.
Exactly. Not just on the kids, but on the parents too. And so parents are sort of mixed up about what they ought to be teaching their kids. And I think the research, the data, like I said before, we're a scientific organization. We're not trying to pull out of the Bible things that we want to say, but we're just trying to say, here's what the science says. And we want to reinforce parents to know the message they need to teach their kids is you don't have sex unless you're married.
And that is what scientifically shows huge benefits in emotions, right? In physically not having these sexually transmitted diseases, which we need to get into more deeply. People don't even realize how debilitating that's going to be for you, and how it really doesn't take too many partners to have that, right? You can have one boyfriend, then another boyfriend, and because they've had another boyfriend, you just...
That's exactly right.
Right.
We've seen some diagrams that show this one person's had sex with this one person. That person's had sex with 2 or 3 others. We don't push this chart out on people, but it really shows that you've had sex with all these people. And in one sense, as far as the diseases you have,
that's
herpes with this one up here 3 times ago.
I hadn't thought about it that way, but you've had sex with all these people that you're...
Herpes is very communicable. HPV is. About 20% of all Americans have herpes, and once they have it for their whole life long. About half of Americans have HPV at some time because there's so much sexual mixing going on. And human papillomavirus is the cause of all cervical cancer, essentially all penile cancer, all vulvar and vaginal cancer. It's also now because of oral sex being so common with our kids, and they even think because of Bill Clinton said it wasn't sex, well it is.
And they also think, oh, I won't get pregnant.
They say they can't get pregnant.
It doesn't stop you from getting STVs.
No, they got HPV from that. There's an epidemic of cancers of the mouth and throat now among young people. Well, they have to be a little older by the time it turns into cancer from human papillomavirus they're getting from having oral sex, and they don't know that. And oral cancer is horrible. I mean, a lot of times for treatment, you have to have your tongue cut out, or you have to have radiation. I have a friend that got radiated so badly to cure it that she couldn't even drink water without it just scalding, feeling like she was scalding her mouth. It's a horrible cancer, and yet it's rampant right now with our young people. By the way, Natalie, there's one other thing I wanted to touch on, and that is that people also think that they can have sex and not get diseases by using condoms. That is a lie. We've got the research on it. The research came out of a consensus conference that actually helped push the development of, with the CDC, NIH, and FDA around the year 2000. And it shows that for the common diseases like syphilis and gonorrhea, and chlamydia, and so forth, if a person uses their condoms every single time, never uses them wrong, that it reduces the risk they're getting the diseases by about 50%. It doesn't eliminate it, but it does cut it down if they use them every single time without a mistake.
That's not good enough for me, a 50% decrease.
I know it. And people think, well, but that's also, I mean, what kid even brushes his teeth every day, you know? For them to remember to use their condoms every time is ridiculous. And we got data to show. That's right. They'll put it on, flip it over because they had the wrong way, and pull it off before they're through having sex and stuff like that. It goes on all the time. So we are also trying to let the data be known for people that condoms are not really protective against these diseases. They can help some, but that means they have to use them every time, all the time, year after year after year, or they're going to get these diseases. And that's why that's why I say there's 26 million new cases every year on top of the people that are already infected. It's just horrible. It really is.
And I think people don't realize the severity of these diseases, and I know you've talked about it a little bit. I mean, you can have these sores, these open sores, for the rest of your life, and anybody, you know, in your, you know, like when you get married, you will be giving that to your spouse. Which, wouldn't it be nice if you just waited and got married, and then neither of you had that, and then you don't ever have that.
That's right.
And you can enjoy, you know, each other.
And I think we have to give an example. My first wife and I never had sex before we got married. We were both virgins, and so we didn't have to worry about this stuff.
Right.
And so first, it really frees you up for more. And second, you can do it. Because I think today people just don't do that, but you can do it.
And people did it for generations.
The Scripture gives us the best guide to live in the best life, the life more free of problems and trouble, and the way to live the fullest life.
And it is very clear in the Bible, in Scriptures, the Lord's way is to not have sex before marriage, or not have sex outside of marriage, and it's really right there in the Ten Commandments.
It is.
Isn't it?
Exactly right.
Do not have adultery. And adultery means having sex outside of marriage.
Absolutely.
And then fornication is listed throughout too, which fornication means sex before marriage. So he's clear. He's just trying to give us the right way. This is the way. I've made this the way, and this is the way. And rejoice in it. And so obviously, if he's given this as the way to do it, it's not impossible to do. That's another lie. There's so many lies that we can break right now, and that's one of them. It is a lie, just like you were saying. It is a lie that you can't wait till marriage.
That's right.
That's not true. You can. Here's another lie.
In fact, it's a normal way to live.
Yes, it is.
Normal way to live.
It is. That's good.
I interrupted you. What were you about to say?
Well, here's another lie that I've been dying to say, because you gave an answer from your scientific, research that isn't, it's just the facts. And another lie is, if it's two consenting people having sex, then nobody's getting hurt, so it doesn't matter. And my belief is there's always somebody getting hurt. And you said it with the depression and the suicide. There is an emotional component to having sex outside of marriage, and it's painful.
Some people say, well, the girl can give consent to just kissing, or then just give consent to fondling breasts. And then the whole idea is progressive. And so the idea for young people is, don't start doing that stuff. You don't be giving consent for this next step, because that leads right into sexual intercourse. So a kid has to decide how far they're going to go. Probably kissing's fine, probably for most, I guess. We won't set standards here, will we, Natalie? But but kids do have to be careful about how progressive they want to be with and they need to stop at some point.
And I think it's good to also think about that.
Yes. Plan
To say,
ahead.
what are you going to allow,
Yeah.
and make a very determined decision,
Yeah.
because otherwise you get to a certain age and, everything. I heard somebody say, I thought I'd be very logical when I found somebody, and then no, poof, my brain just left me, and I went crazy.
That's true. The age of when they get married, the age of marriage has dramatically increased. The average age for girls to get married now is 27. The average age for guys to get married is 31. And so what that means is from the time they're not just going through puberty, let's just say from the time they're 18, they start having real sexual interest in the opposite sex. That means they're going to be going at least 10 years with that intense interest in the opposite sex. And I think that's one reason so many have had sex before they get married, because it's just such a long period. They feel like they just can't hold off sex for that long. And indeed, most of them don't. By marriage, Mark Regnerus, there in Austin, the tenured professor that I refer to a lot, has shown that most people will have had sex by that time. So that's hard. And so we're not saying some of what we're saying is easy, but what we're saying is the benefit is so worth it. It is just worth it. It's an investment in your future that's really worth it.
And prayerfully, if you can, if the Lord leads you to that person earlier, go that route.
Oh,
with the right person.
I'm very much in favor of young marriage. I really am.
And
as a matter of fact, I have 10 grandkids. 4 are married, and they all got married before they were 25. And I just think it was just perfect.
And there's a verse in the Bible about that. Blessed is he who finds a wife in his youth.
Yeah, oh yeah, I'd forgotten about that one. That's true. Well, it's really amazing when you bring that up about what Scripture says, how there's something about sex all the way from Genesis to Revelation. It's just, I think it's one of the primary messages of Scriptures for us as human beings about how to live the healthiest and best lives. It's just everywhere.
Yeah. I do, and I look at it also as a false god.
I agree.
So it's one of the big kind of like money is listed in the Bible as a very strong false god.
Yeah.
And I think sexual immorality,
I think you're absolutely right.
Is a false god. And literally, you think about it, our society becomes completely consumed with,
if we worship at the feet of that God, we know what happens when we worship at the feet of other gods, like the god of money or pride or whatever. It's destructive. It hurts us as a human being.
Should you talk more about some of the STDs and what because, and I know you mentioned before, but they are debilitating.
Yeah.
They can cause death. Women don't even know they have this sexual transmitted disease until they're infertile, right? With chlamydia.
Let's talk about chlamydia for a minute. Chlamydia is rampant. Probably 5 to 10% of teen girls who've had sex have chlamydia. And chlamydia, for most people, and I'm talking about something I saw in my practice. I'm talking about real patients I saw who would come in with some discharge. We'd test them and have chlamydia. They'd had sex. I remember one girl that had come from a little town nearby and had some pelvic pain. And so when she came in, she'd had sex with a big football star at her high school. Test her, she had chlamydia, and she'd been having symptoms of this for a while. Most kids don't have symptoms. They might have a little vaginal discharge if they're girls. But most of them don't know they have it, don't get treated, and it will sit inside their bodies, eating away at their fallopian tubes, producing scar. Come in to see me, then 2 years after they get married because they can't get pregnant, we laparoscope them, we look in there, and it looks like glue's been poured all over these delicate fallopian tubes, and then the egg can't get from the ovary down the tube, or if it does, it'll often get caught in the tube. The sperm can swim up into the tube, fertilize the egg there, and it's a tubal ectopic pregnancy, which is dangerous. So there are so many problems from chlamydia, and it's so rampant among young people. And they don't know they have it.
Preventable.
And it's preventable by not having sexual intercourse. Condoms, again, not very effective against it. Matter of fact, you can't trust condoms over a period of a year having sex with the football star, like this girl had done. Then you're probably going to get infected into the fallopian tubes. So it's a terrible infection. And like I say, it is the second most common reason if the woman's an infertile person in the couple to be infertile is because of chlamydia, sexually transmitted disease, that she probably got back in high school or college. By the way, guys carry it. They give it to the girls. They have hardly any symptoms. Most guys will have no symptoms, maybe a little discharge from their penis, but mostly not. Then you have herpes that's just extremely infectious. And a girl or a guy can have it just a little pimple. They think it's a simple pimple, and that can be a breakout of herpes, that then when they have sex, they give it to the other person. And it can be anywhere on their vulva, anywhere on the penis. Even if they use condoms, first, they don't work real well anyway, but even if they have a condom, it may still be above the condom or somewhere on the vulva. And that's why about 20% of Americans have it right now. So then when you're going to get married, we mentioned when somebody gets married, they have to worry about giving it to their new spouse. And Steve got it when he was in college, a friend of mine. And he knew he got it. Then he became a believer in Jesus and followed him, but didn't have sex anymore in college and then he got married. Told his wife that he had herpes. They had a baby, no problem. They had to deliver the second baby. Then on about the second day the baby was at home, this baby stopped breathing, turned blue. They were successful in getting the little girl to the hospital in time to get treatment. And it was herpes that she had broken out with the second delivery, given it to the baby, and the baby almost died. And you talk about the guilt on the part of this wonderful man, Steve, that did this from his sex back in high school. So there's a lot of emotion and guilt associated with it that people just wouldn't have if they didn't have sex until they get married, you know.
And does that baby then have herpes the rest of their life?
Yep. The baby has herpes the rest of her life and will be on antivirals, viral suppressant drugs for the rest of her life. That's right. So for a while she was having blisters break out on her fingers and stuff like that. But they've got
this little baby.
Yeah, and then a 10-year-old. I mean, this kid now is almost 20. So this happened, came to my attention way early in my concern about this issue. Then human papillomavirus is in the liquids, and sex is sort of messy, you know? And so it's that liquid stuff that has HPV in it, human papillomavirus, that's a rampant infection that we've already talked about. It causes all cervical cancer, almost all penile cancer, almost all vulvar cancer, and it is rampant now, causing oral and pharyngeal cancer because of oral sex. And condoms basically have almost no protection against it at all. For somebody that doesn't develop cancer, for example, of the cervix, within a couple of years, the body's will usually get rid of it from the body with the body's own antibodies, but it can stay there and cause the cancers we're talking about.
And I remember back growing up, there were two.
Yeah, good point. Syphilis
and gonorrhea. And those were just so horrible.
Yeah.
And now there's just a multitude, isn't it?
Yeah. When I started practicing in '68, syphilis and gonorrhea. Of course,
And you can treat those. Do they go away?
Well, no, they don't go away. You have to treat gonorrhea
for the
with
rest of your life. You have those.
No, you can treat gonorrhea with penicillin, but now there are a lot of resistant gonorrhea organisms. But almost always it can be cleared up with antibiotics. Syphilis is still totally treated and susceptible to penicillin. But the trouble is you have to know you have it. And that's the other thing. My partner had a lady with syphilis, and so he had me come over and look at the slide of the spirochetes. There's sort of scary little germs in there, but it's treated. But it's a painless sore that you get when you get your first syphilis infection, and guys don't like to go to the doctor, so they have a sore. It doesn't hurt, so they don't see the doctor because if it doesn't hurt, it's not bad, right? But that's syphilis. Then it goes inside their body, and they can produce secondary syphilis, which is sores all over the body, and then tertiary syphilis, which is neurosyphilis, which causes you to. The most common reason for people to be in insane asylums back in the turn of the century was from syphilis. And through the years, I'm talking history of Europe, a lot of kings and people had syphilis and went crazy.
And
so
it's
a bad. Oh, by the way, another thing, Natalie, and that is that there's been an epidemic now of congenital syphilis, which means when the mom gets it while she's pregnant, or perhaps had it before she got pregnant, then she gives it to the baby, and the public health people are terrified because this epidemic of babies getting syphilis now is exploding all over the country, and they almost don't even know what to do about it. They're saying, well, moms need to get tested twice during the pregnancy and so forth. But a little baby gets syphilis, and about a bunch of them will die. I think about 25% will die if they get congenital syphilis. But about half of the ones that aren't will have some kind of permanent abnormality. So it's a horrible infection.
And so just the encouragement is, go ahead.
We started with 2 STDs, syphilis, gonorrhea. The CDC now says there are over 30. And we keep having a brand new one. You know, we just recently, about 2 years ago, realized that there's an epidemic of cowpox going on now. They don't call it cowpox anymore. They feel like that sounds bad. So now they call it CPOX. Well, it's a sexually transmitted disease that's a new disease that people have to worry about. Anyway.
And so all this is preventable. All this is changeable.
That's right.
But be aware of lies that are out there. I want you to talk about your organizations and what you're doing. It's just incredible.
We are the science group that people trust around the country. CDC is, a lot of their stuff is good, but it's hard to access. But the pregnancy resource centers, the sex ed groups, particularly the abstinence education groups, some public health people around the country have been using our materials for long because they know they can trust us. We don't twist the research. So today, what we're doing is we're continuing to keep our research up to date. I just mentioned the fact that we dug in the research, found that kids that have had sex are more likely to be depressed. There's an epidemic of depression among young people today. Then we realized that, for example, Planned Parenthood had a coalition, the Advocates for Youth, SICAs, all these other groups, but we didn't have a coalition. And so I'd been involved in this by this time 25 years. And so I started calling my friends, and all of us agreed that we needed a coalition. So we put together the New Sexual Revolution Coalition. And so we'd encourage anybody that's interested to please contact us, and we'll let them know about the coalition. They can be a part of it. You don't have to pay dues, but you can be a part of being updated on the science and so forth. And we have a First Friday call every month for that. I have about 200 in that group now.
200,
but most of them are people that have, there's some people that just are interested, but a whole lot of these are the leading abstinence education groups around the country, pregnancy resource centers, major organizations. You know, we've had, at some point, Jim Dobson, Focus on the Family Research Council, representatives as a part of it. So it's really pretty neat. Because we get together on that First Friday call and sort of review significant things that are going on. So it sort of keeps everybody up to date.
And there's two other things I really want you to cover:
Okay.
K-12 standards
Okay.
and that education program there, and then the moment.
Yeah. Okay. There's an organization called SICUS that is, their philosophy is hard. It's just saying, look, go ahead and have sex. It's just, diseases are just a normal part of having sex.
That's
Don't
what
worry
this
about
organization is
those.
saying.
Yeah. So that's where a lot of those, like Planned Parenthood, SICUS, Advocates for Youth, are saying, look, we know you're going to have sex. We know you'll get an infection of some kind of disease, but that's just sort of part of life. So just learn to live with it, and certainly see a doctor and get it treated. I mean, it's sick. That's
And
really what
to
they're
me,
saying.
there's lies in that, because they're not telling you the true
Yeah.
difficulties that you're going
Right.
to have with this lifestyle.
That's exactly.
It's going
they're
to cause a
not.
lot of pain for you.
That's exactly right. They're just lying. They are. They're just lying about the significance of the diseases and saying, yeah, they're not that bad. Okay, so SICUS had done these guidelines for guiding kids all the way from the kindergarten through high school. And we had done a set of guidelines a few years ago, but we hadn't really published it. So we had a group of educators get together, and it was actually a subgroup of the New Sexual Revolution Coalition. We had a group on biologic congruence about the gender problem, and this other group, the education group, put these guidelines together. We developed them, we wrote them, we printed them out, and we distribute them, but we are not really a sex education. That's not our organizational goal. And so we turn these over to a group called Ascend, that is the organization in the country right now that has put together sex ed programs. And so they now have them. These are the best sex ed guidelines. Matter of fact, Natalie, a parent ought to have these, because it gives them all the way through K through 12 what to say to their kids about sex. They're phenomenal. And I wish they'd catch on, because they're really that good.
And you're putting these then in schools, or presenting these
They're
as
available.
options so they can get them.
The third thing, okay, so we got that. We're keeping our research up to date. Second is the New Sexual Revolution Coalition. It's about, like I say, about 200 groups, not just individuals. If we wanted individuals, we could advertise it, but what we want are people that are doing education, teaching, and so forth. The third is a miracle. I've had contacts with people all over the country for years who are concerned about kids' sexual behavior. One is Peggy Hartshorn at Heartbeat International, which is the biggest association of pregnancy resource centers in the country. Peggy and I have been friends for years. She said, Joe, you need to have Zeke come down there and work with you on that coalition thing, on that New Sexual Revolution Coalition, because he's retired from Procter & Gamble. He's brilliant. He'll help you organize. Well, he did. He helped us organize into these work groups, the education work group that did the standards, the biologic congruence work group that's done the major research papers about how gender transition is not helping kids. They're more likely to be depressed after they do it. The third thing, though, is that Zeke said, you need to have the people from JDA come down. They're a marketing company. So they came down, spent one day. The owner of it and the now president heard this stuff that we're talking about right now, said somebody needs to do something about it. Well, I'm a doctor. What do I know about marketing, Natalie? And so they said, we want to do it. And so I was able to raise the money for them to do research on who they'd go to, how they'd get to them. They'd go to Gen Z girls, they're most susceptible. They'd do it through their social media, TikTok, Instagram, chat, what is it?
Snapchat,
and YouTube.
YouTube, yeah.
Snapchat. Then they turn it over to their creative department. Now, Huff, who is their creative director, is the one that did the little giraffes on the advertisement for the ARC experience in Kentucky. A lot of people have seen these little giraffes. I mean, it's just so creative. Anyway, he's brilliant. This company also does PGA. They do Ruth Chris Steakhouse. So they're a big marketing company. Anyway, so they did the research, who to go to, how to get to them. Then Huff went back to his home and he told his 15-year-old daughter, we're going to do this thing about STDs for this client. And she said, you might as well give them their money back. We won't listen to you. So so he took his whole creative department off to D.C. and had a retreat. Came back with the idea of doing a choose your own experience. I didn't even know what that thing was. So what they did a full-length movie with actors, actresses in Leesburg, Virginia.
Look, I didn't mean for it to turn out like this. Things just got out of control. It wasn't even my idea. I didn't even want to go. As if you would have made better choices.
They then designed it technically so the kid can go on this thing and say, I want to go upstairs, have sex. Oh no, I got a disease. Choose, I don't go upstairs. Or choose, I'm going to drink. Or choose, I'm not going to drink. So they can play with this thing for 2 or 3 hours.
So it's like an interactive experience. It's almost like gaming.
It's
and there's
exactly
lots
right.
of gamings out there that do this,
That's
where
right.
you can choose your experience, but because you're online, you can change your mind and
right.
try a different route.
That's right, and that's exactly what it is. And it went public. We can tell people, well, I can tell them how to get to it. It's just www.themoment.video.
And it is the moment.
We don't want adults going on TikTok or Instagram to find it. They could, because we want kids on there. Because we are getting the data and the statistics of how many kids go on that. So if an adult wants to see it, www.themoment.video. Instantly, you'll be into this game. You will not like it as an adult. You can't hear it very well. It goes too fast. It's sort of dark. We actually let the actors use some profanity. We don't show nudity. But what it shows is that if a kid makes the wrong decision, they suffer. We are going to be doing one a year for the next 10 years. They're very expensive to do, so anybody who wants to be a part of funding this thing, we'd love to have them help. But so far, God has been providing the money for developing these things. The next one is going to be, we've already done the whiteboard, which shows the sequences for the actors. It's going to be filmed in Houston and be Friday Night Lights. So we already have the titles of what we're going to be doing. And see, the whole, we are not deviating, we are not going to change our ultimate goal that in 10 years the kids say, I'm not going to have sex unless I'm married. Matter of fact, we want the 9th one to be a wedding. So we're going to be moving that way. There's going to be no mission drift with it at all. Because it's always easy to say, well, do we want to be this restrictive? We are.
Only for the blessing of it, because it's such a great thing to wait, because so many good things fall out from there. And there's all these difficulties, you know, the suicide, the depression, the emotions, the
Poverty,
STDs, the poverty, just goes on and on.
Yeah.
From you know, this glamorized way
misunderstood
of sex before
sexuality.
marriage.
That's right.
So definitely. So final thought.
Well, I'm 89. Okay, I've been doing this for 30. Actually, from the time I wrote that first book in '85, that Jim Dobson saw, then we did multiple programs. The ones on STD always got people's attention, and really made my concern even stronger. To today, that's 50 years, almost 50 years I've been involved in this. Now we've got this really creative idea for getting to kids across the country and around the world. I think God has kept me alive all this time to see this beginning to happen. And it thrills me to death. It makes me feel like, yeah, He's had me in the right place all this time. If I can be a catalyst for people to get concerned and then to start trying to find the answers to this for their kids, to help parents want to really give their kids really good spiritual and biologic guidance, it just thrills me to death. And one example, when I say to have an impact around the world, I was talking to a guy in Africa that I've interacted with for several years, and he started taking, what's new? I said, well, you need to go on www.themoment.video. The next day, and he did, the next day he sent me this email, he just went on and on. He said, that is so incredible. We need this all over Africa. Of course, right now it's in English. There are a lot of English-speaking people in Africa. Yes. But yeah, what a miracle that God has given this gift to us, a way to communicate with every kid in the country. And we saw research just 2 weeks ago that a third of kids are on their social media all the time, all day long. What an opportunity that God has given us now to maybe reach kids the way we want to.
And the way they are used to and will hopefully change their behavior for the better.
Without feeling like we're preaching to them, because they discover it. They're discovering organically. They don't even know it's coming from medical. They won't have a clue where it's coming from. Matter of fact, we don't want them to know that. Mm-hmm. We want to think, ooh, this is really neat. I don't care who did it. Yeah. And they're not preaching to me. They're just, this is what might happen. And so, you know, but the other thing is that when you do something, nobody's ever done this before. Even the technology where they can smoothly go from one to the other, in the experience in there, you don't know where it's going to go, where God's going to take it. But certainly we feel like it's where He wanted us right now. So.
Your work is amazing. It is a miracle that God has called you, as we were talking about when we were off. You know, God has called you to this, and you have made great impact in having this research available for people and education in so many areas, building this coalition, and now the moment and this interactive gaming for children that age, Gen Zs, to prevent lifelong tragic choice in many ways, and in many ways, physically and emotionally. Thank you so much for being here. And medinstitute.org is the way to connect. Appreciate it.
Thank you very much for letting me get a little of this message out, Natalie. It's a joy. So thank you for what you're doing. It wouldn't happen without you. So please keep it up. God bless you.
Thank you. And we thank you so much for joining us. So much information today that we can re-look at, and as this organization does, they work for optimal sexual health for youth and everyone. So we can impact in our lives, understanding the lies, and be bold to encourage what is right. Thank you for joining us as we walk together in the right direction. Look forward to seeing you next time.